Hi everyone, my name is Katrina. I'm a pelvic floor physical therapist and owner of Whole Body Wellness and Physical Therapy. And today I'll be talking about bone health and how you can build strong bones to prevent or treat osteopenia or osteoporosis, which is also known as having very low bone density. I'm really passionate about bone health because I strongly believe this is something that you can maximize in your 20s and 30s so you can prevent having hip fractures, wrist fractures, and those type of issues later down the line. So in today's little masterclass, we'll talk about the definitions of osteopenia and osteoporosis. We'll go over why it's really common during perimenopausal and menopausal years. And then we'll also talk about the treatment for it, what you can do, and how you can build strong bones. So specifically, what type of exercises you should be doing. So what is it? Osteopenia is known as having low bone density. Osteoporosis is having severe loss of bone density, which just puts you at an increased risk of a fracture. And some of the most common locations of having a fracture are your wrist, vertebra, so your spine, or your hip. Now, I commonly recommend that all women should get a kind of assessment of their bone density. And this is typically done with a DEXA scan. And a lot of my patients tend to get it at 65 because that's when they are on Medicare insurance and that's when Medicare will cover it. However, I do really believe that it's really important to take more preventative action. I have a lot of patients in their late 30s and 40s who already had fractured a bone, and when they did their DEXA scan, they had shown signs of osteopenia or osteoporosis. So you shouldn't wait until you are 65 to get the DEXA scan. So if you do have a history of osteoporosis in your family, or history of just having a lot of bone fractures in your menopausal years in your family as well, I would highly recommend getting a DEXA scan. One of the biggest, I guess, signs that you're losing bone density is a loss of height. So if you measure your height every year, which they typically do when you have a physical exam at your doctor's office, if you notice that you're losing height, this could indicate that you are also losing bone mass in your spine. So osteoporosis affects 200 million women, and 1/3 or 33% of women over the age of 50 will experience some type of bone fracture. One of the most common types of fractures are the wrist fractures. So those are the ones where you're walking and then you fall, so you kind of stretch your arm out. So it's called falling on an outstretched arm, and that could cause a lot of pressure on your wrist and cause a fracture. Now, a majority of the bone loss that occurs is within the first 3 to 4 years after menopause. So menopause is just the point in time that's 12 months after your last period. So let's say you are in your 30s. Once you kind of reach 35, 40, you're kind of already perimenopausal. So your body is already starting to change. Your estrogen levels are already, and also your progesterone are starting to slowly decline, just because you're not ovulating at every single menstrual cycle. Now, we'll also go over more about the hormones, I think, in the next slide. So again, most of the bone loss will occur within the first couple years after menopause, and then after that, you'll still get bone loss, but it won't be as significant. It'll be a lot less, and it'll be more gradual. So if you're looking to strengthen your bones, I highly recommend doing it as early as possible. So research is showing that those who strengthen their bones in their 20s and 30s, that is when you're generating your peak bone mass, so your strongest bones ever. And that is when you want to strengthen your bones so that you can prevent or kind of delay this process of losing your bone density once you reach menopause. So like I said before, your peak bone mass in your spine and your hips is around your mid-20s. And then for other bones, like your wrist, it's around your early 40s. So again, what that means is if you are watching this and you are in your 20s, if you are pregnant, postpartum, in your 30s, that is when you should be optimizing your bone mass. You don't want to wait until you have the diagnosis of osteoporosis to then start strengthening your bones, because you have to be more gradual if you've already been diagnosed, because you don't want to overload your bones that you could possibly fracture. So you want to try to maximize your bone mass when you're young, because that's when your bones are strong and healthy. So this is a really good diagram just showing the hormone levels throughout life. So when you're first born, your estrogen and progesterone levels are pretty low. And estrogen and progesterone are really important hormones that are mostly produced by your ovaries and play a really big role in your bone health, your muscle and tendon health, your ligaments, cartilage, your heart health, brain health, so all of those things, even gut health. So these hormones have so many different roles in your body. And during puberty, your estrogen levels tend to be a little bit more higher than your progesterone. And that's because progesterone is produced after you ovulate. And during puberty, you don't always ovulate with each cycle. So ovulation basically means that an egg is released from the follicle of your ovary. So during puberty, again, you have higher estrogen relative to your progesterone. So that's why you might feel a little bit more irritable, moody, more agitated, maybe more heavy, irregular periods. During your fertile years, that is when your estrogen and progesterone really increase, just because you might be having a baby and your hormones are kind of going up and down again. And then it's during perimenopause when again, your estrogen levels are a lot higher, but they're declining, but they're still relatively higher than your progesterone, because during perimenopause, you may have a period every month, but you don't necessarily ovulate each month. So that's really important to know, is that if you are perimenopausal just because you have a period every month doesn't mean that you're ovulating. And again, when you ovulate, that's when your progesterone is produced. And progesterone is really important for maintaining like the lining, the uterine lining, and just making sure, like maintaining the uterine lining so that you don't have too heavy periods. And then after menopause, that's when your estrogen and progesterone levels are really low. So that's when that's where we see things like bone loss and hip fractures, and you may be like hunching over more because you're losing your bones in your spine. Again, wrist fractures from falling. So you can see that your hormones change throughout your life. But again, once you reach menopausal years, that is when your hormones are very low. And that is why it affects your muscle health, your tendon health. You may notice that you're getting a lot more injuries with very basic activities. That affects your heart health and especially bone health, which is what we're primarily talking about. So again, it's really important to have regular menstrual cycles, because that ensures that your hormones are being produced regularly. And again, like I said, your hormones play a really important role in your overall bone health. So what can you do? So, well, the first thing I recommend is, if you are watching this and you are in your 40s and your 50s, and you have a history of osteoporosis in your family, I highly recommend asking your doctor for a DEXA scan to assess your bone density. Otherwise, I highly recommend that everyone should be doing some form of exercise, now specific types of exercises to strengthen your bones. So again, you really want to optimize your peak bone mass in your 20s and 30s, because again, that's when your bones are the strongest, and that's when you can lay down the most bone. That's when your bone cells or your osteoblasts are really doing a good job at laying down bones so you can be nice and strong. It's really important to have a combination of strength training, endurance exercise, mobility, so like yoga, for example, and balance, because doing balance exercises like standing on one leg just loads your bones way more than just standing with both legs on the ground. So if you're, you know, it's really important to get like a combination of these things, because if you're just a walker, that's not going to be good enough to strengthen your bones. You need to add weight or resistance. So adding in some dumbbells, even if it's just like 5 to 10 pounds as you're doing your squats versus doing just body weight squats, that can be really helpful. Nutrition is also really important. So having a diverse protein diet, so especially grass-fed meat is really important. Having a lot of plants in your diet, that's going to optimize your gut microbiome. Your gut microbiome is all of the bacteria in your gut that play a really important role in producing hormones and getting rid of all the bad stuff and the waste in your body. And more important than the amount of vegetables that you eat is the diversity. So if you're eating bell peppers and carrots and onions every single day in your omelets, try to diversify that and add some spinach or mushrooms. So you want to try to get different types of vegetables in your diet because each vegetable has different vitamins and different minerals that can help serve you well. In addition, vitamin D and calcium are also really important. So it's through yogurt, cheese, milk. I'm in my late 20s right now, and I'm taking my calcium supplements every day. Now I only take half the dose because I get the rest of my calcium through the foods that I eat. Specifically, I have cheese every day. I have at least 2 cups of milk. It can be like regular milk, vitamin D milk, oat milk, almond milk, any of those options. And then I typically have yogurt maybe a couple times a week, but not every day. So I like to add the calcium supplement just so I can, reach my calcium daily value. Vitamin D is also really important, so you can also get that through being outside. Now, I highly recommend to get the maximum amount of vitamin D or the best vitamin D is to go outside for 8 to 10 minutes without sunscreen around noon, because that's when you'll get the best vitamin D for your body. Like I said before, if you are a walker like I am and you just really love to walk, walking is just not good enough to strengthen your bones. It's not enough load. So if you are a walker, try to add some incline. So go hiking, try to find a neighborhood that's a little bit more hilly. You could also vary the speed of your walking. So you can even do power walking, or you can wear a weighted vest. So I have a 12-pound weighted vest that I'll wear during my walks. A lot of my patients with osteoporosis, they usually start out with a 4-pound vest or a 6-pound, depending on your height and weight, depending on what you can handle. That's another great way to just add some extra load to your exercise, even if you really love walking, so that you can still do the walking. Yoga and Pilates are great, and also physical therapy. So as a physical therapist, I do see a lot of patients with osteoporosis just coming to me for wanting guided exercises and specific exercises to target muscles to help strengthen their bones, improve their posture. What's really important is that you're doing diverse types of exercise because your body loves diversity. It loves doing different things. If you're doing the same thing over and over again, you want to make sure that you have enough diversity in your movement that you're stressing the bones in different directions, because you want to stress your bones forward and backwards, side to side, and rotation. You don't want to just be one-dimensionally strong, because if you fall, you don't know which direction you'll fall. You might fall to the side. You might do a different rotation type of twist type of thing. So if you are strengthening your bones, again, if you're doing weight training, you can add in some deadlifts and squats. We can also do some rotational type of exercises. Yeah, basically you want to add in rotation if you're just doing kind of forward motion type activities. So diversity is key. I think that's the main point I'm trying to say. So I hope this masterclass is really helpful. Again, we just talked about osteoporosis, osteopenia, trying to get your DEXA scan as early as possible, and most importantly, taking action now when you are, especially if you're in your 20s and 30s, to just maximize your bone mass when you are younger, just to really prevent these things from happening in the future. If you really love this video and looking for more just information to learn, follow me on Instagram at Whole Body Wellness PT. You can even send me an email. I'll be glad to talk to you. If you are in the Bay Area, I do provide in-home therapy visits. And if you're interested in learning more, you can also schedule a 15-minute phone consultation with me. Just check out my website, wholebodywellnessptca.com, and I'll get back to you. Thank you.